Okay, we're going to hear next from Dr. Lowe. She is a staff psychiatrist at the Savannah Seabach. Really glad to have her here. She's also a veteran herself. I'll turn it over to you.
Thank you. Thank you all for being here and listening to this today. So, I'm going to be talking mostly about mental health medications in pregnancy and postpartum. I know there are a lot of related important time frames and situations like leading up to pregnancy, breastfeeding, um, loss or termination of a pregnancy, fertility treatment. All those are important. Um, Today I'm going to be focusing mostly on general concepts, and some of them apply to those situations, but just um, today we'll mostly be focusing on pregnancy, postpartum, just for time. So, first, I'm going to talk a little bit about the history of how we got to the point of there being a lot of just general anxiety about mental health medications in pregnancy overall. Um, then I'll talk about how our perspective has moved forward from that and changed. Um, After that, I will make a couple of suggestions and recommendations of where to start and how to use this information. Then we'll wrap up. So, just a quick note, I'll be saying fetus. That is the term we use to refer to an unborn human being after 8 weeks. Baby just refers to after delivery. So, the background, so it's really common for women to become pregnant or try to become pregnant and assume they should just stop their mental health medications. So this slide is kind of about, this part is just about where that came from, since it's really not consistent with our current ideas. In the 50s and 60s, there was a horrible disaster with a medication called thalidomide. It was a medication that was used for nausea and as a sedative for women during pregnancy. In the 60s, we learned that it caused very severe birth defects and disabilities to babies who were born for moms who had taken thalidomide. This is Dr. Oldham. A quick note. So it actually, thalidomide never even got FDA approved in the United States because of this woman. She just started her job with the FDA reviewing new medications, and she stopped thalidomide from moving forward in the being approved for marketing because there wasn't enough safety information on it. So that's an aside, but you can. Uh, so that's one of the factors that led to kind of the mindset of, okay, we need to stop because of all those birth defects we saw with thalidomide all over the world. That's was so that was kind of the philosophy. You can't take a medication at all when you're pregnant. So it was also an earlier perspective was that it's not ethical to study medications during pregnancy because of the risk to the fetus. Um, Now we're the reality is and always has been that mothers develop medical conditions too, just like anyone else does during pregnancy. And it's important to treat those medical illnesses or mental health conditions for her to be able to have a healthy baby and also be healthy herself. So now there's more focus on not just saying no medication, but on actually researching effective medications for pregnant women and women who are breastfeeding. So this slide here is just to show how common these issues are. I think sometimes women will feel alone in these issues, but they're just incredibly common. Um, just in the first numbers are just about general medications during pregnancy. In the first trimester, over 80% of women take at least one medication. Also, in the first trimester, nearly 30% of women will, at least for some time, take four or more medications. So, women are taking medications during pregnancy. Mental health conditions during pregnancy and postpartum are also extremely common. I'm using depression and anxiety as an example here. About 14% or 1 in 7 women experience depression and anxiety either during pregnancy or in the first several weeks after delivery. Tying those two together, mental health medications during pregnancy are also very common. Nearly 8% of pregnancies have the mom has taken an antidepressant, anti anxiety medication. Um, Other types of medications would be less common, but that's really only speaking to the medications for depression in that statistic of almost 10%. So next, the CDC has this term of treating for two. So rather than thinking of this as should I take a medication if I'm trying to become pregnant or if I am pregnant, we can take that like should question really out of it completely. A better way to think about it, that's not all this pressure, and is actually more beneficial, is to look at it as the question of what are the risks of the medication to the mom versus what are the risks of the untreated mental health condition like depression or anxiety or others on both the mom and the fetus. So it's a risk question, not a should question. So we know that basically what happens to the mom during pregnancy happens to the baby as well. So the physiological, that anxiety, panic, depression, staying in bed, not being able to, not feeling up to exercising, having trouble making decisions, having a hard time making it uh, to OBGYN appointments, all of those things have an impact on pregnancy, both by, if the mom is having those types of symptoms after delivery, it's going to be much harder to bond with the baby by no fault of hers. But we also know that untreated depression and anxiety in pregnancy can actually can increase the risks of objective issues like untreated depression and anxiety can result in a higher risk of early delivery, preterm delivery, smaller birth weights, and lower APGAR scores, which are basically function of the baby right at delivery. So often those risks of the untreated mental health condition may outweigh the risk of the medication itself. So that's not a blanket statement. The important note to that is that it's case by case. Every woman is different. Every situation and type of symptoms need to be considered individually. So that's where your doctor will come in to work with you on finding the safest medication of the medications we have as options to treat these conditions. So I'm gonna just quickly mention a couple of myths. So there's just the antidepressants, anti-anxiety medications are so common. I just wanted to mention briefly something that's basically a myth, which is that women who take antidepressant, anti-anxiety medications in pregnancy, their baby will have a withdrawal. So that's really not true. There's something called neonatal adaptation, which happens. It's happens to babies born to moms who have taken an antidepressant, anti-anxiety, as well as to babies of moms who have not. It's a little bit more common in moms who've taken one of those medications. It's a mild restlessness. Baby might be a little bit more fussy, and it resolves on its own in a few days without a higher level of care. So that's a common misconception. I mean, there are medications that may cause a withdrawal, but again, case by case, a lot of the very common medications do not cause a withdrawal. So basically, what do we do about these issues? First, it's great that you're here and listening to this and investing time and energy into your health and well-being. So as far as steps you can take after that, so just in general, knowing your medications, what you're actually taking and putting in your body, that could be prescription medications, over-the-counter vitamins, supplements, really anything. So just in general, you can kind of think about what's healthy even before even thinking about pregnancy. So it's also important as you're educating yourself to be mindful of things like the internet. A lot of the information with mental health, unfortunately, is still biased with a lot of stigma. It may be out of date and old school, and that's just really not helpful. So it's important. This was already covered, but let your primary care provider know and mental health providers know as soon as you can if you are either thinking about becoming pregnant, or if you do become pregnant, or really if you're not using any kind of contraception and you're sexually active. It's important to remind your doctors about that as well, and it's something we try to make ask about, but it's something to be aware of that, if you're not using a contraception, it's important to think about these as potential issues. Important to know the details of the medications and supplements. Also, if you are using alcohol, tobacco, substances, we're not here to judge anyone about that. We're here to offer treatment options for those issues during and also outside of pregnancy. So we just want to connect you with options. So if that is an issue, any type of substances, alcohol, and you're trying to become pregnant or you are, let us know so we can talk to you about treatment. Also, just of course, optional, but if you do have a history of trauma or trauma-related symptoms, pregnancy can be especially hard. The treatment can be especially hard. So, you don't necessarily have to go into detail if you don't want to, but just letting your providers, your OBGYN, primary care, and your mental health providers that you have those trauma-related issues can really help providers to tailor their treatment, modify things, and just be considerate and aware in their treatment. Also wanted to let you know, your mental health providers, we can also coordinate with your medical providers. We have the expertise in mental health, so we're definitely glad to work with you, but we can also help with that coordination since we have that extra information. Another topic is if you don't feel comfortable and you just feel like you're not getting the answers to the questions that you may have, and you're just kind of struggling to feel confident in these decisions, it's okay to request a second opinion. It's important to make sure you're getting answers to all your questions. So that's something that happens a lot. You're welcome to do that if you need to. And then important reminder, you're welcome. This is in general, pregnancy or not, but especially during pregnancy, sometimes our appointment timeframes are booked quite far, and that's really not helpful for pregnancy. So you always have the option to walk into any VA medical facility nationwide to be seen by mental health. So if you walk in, come over to mental health area, someone will talk to you or see you and will help. So in conclusion, there's still a lot to be learned. Every situation is different, which is why it's so important to involve mental health in this decision-making process. But just keep in mind, it's not a should issue. It's an issue of, what's going to be healthy for you as a mom is also going to be helpful to the baby. And we're here to help with that. So these are just some research. There are lots of good resources. These are two that are especially good. The first one, Mother to Baby, is a website that has these fact sheets that are up to date, all evidence-based on medications, but also about the conditions themselves, like, alcohol use, depression. And then it also has an option where you can call, text, chat, or email a staff member with that website for a free personal discussion about pregnancy breastfeeding that's available. And they also have links to other resources. So this is it's an excellent website. Sometimes I'll even use that in my sessions when we're talking about these issues with veterans. And then the next one is the Mass General Hospital Center for Women's Reproductive Health. I think their pregnancy resource center is helpful too. I would think mostly because it has a lot of links to other resources too. I think it's less informative as far as the specific medications than the first one is, but this also has a lot of other resources that you could potentially use. So that's about it. Thank you, everyone.
Thank you, Dr. Lowe. That was great. Really important information that I think clears up a lot of common misconceptions.